Hello, I'm Pauline Maki, Professor of Psychiatry and Psychology at the University of Illinois at Chicago. I'm happy to be here today at the IBSA Foundation conference on healthy female aging. My particular topic today was, can we age well in terms of brain functioning? This is a very important topic because currently worldwide there are 34 million people with Alzheimer's disease. And there is no cure for Alzheimer's disease. So when it comes to approaching this devastating illness, we need to think about primary prevention. We also care about memory functioning as we age. We're interested in both abnormal cognitive aging and Alzheimer's disease and normal cognitive aging as we age. One of the common misunderstandings about Alzheimer's disease is that there's nothing we can do about it, that it's inevitable. In fact, people who have Alzheimer's disease running in their family oftentimes hold this view, but it's incorrect. Even if you have the genetic risk factor for Alzheimer's disease, there are lots of lifestyle modifications that you can undertake to prevent this devastating illness. One major thing that we can do is to keep our hearts healthy. So cardiovascular risk factors are key risk factors for Alzheimer's disease and for accelerated cognitive aging. So if we maintain healthy blood pressure levels, healthy cholesterol levels, if we prevent diabetes, all of these help to reduce the risk of Alzheimer's disease and help us to keep our memories sustained as we age. In addition, there are some other activities that we can engage in. Exercise, particularly cardiovascular exercise, is good for the aging brain and prevents Alzheimer's disease even in women who have the genetic risk for Alzheimer's disease. In addition, there are lifestyle activities that involve cognitive activities. So keeping our mind engaging in novelty-seeking ideas, even having an engaging conversation with other people helps to prevent brain aging, as does a high education. What about diet? What about supplements? It turns out that there's very strong evidence that adhering to a Mediterranean diet, one that's high in whole grains, vegetables, fruit, with just a little bit of red meat, a little bit of red wine, and olive oil is particularly good for the brain. In addition, soy isoflavones seem to be beneficial for brain functioning. Tai Chi and other stress-reducing activities are also beneficial for the brain. And then finally, we ask questions about menopause. How does the fact that women go through menopause affect their risk for memory decline and cognitive aging in terms of Alzheimer's disease? Well, we know that 2/3 of patients with Alzheimer's disease are female. One reason for this is because they live longer than men, but they also appear, at least at certain ages, to be more susceptible to the genetic risk factors for Alzheimer's disease. Women also transition through menopause, and we know that women experience a temporary decline in memory as they transition through menopause, but the good news is that it appears that this bounces back. Our work suggests that hot flashes may play a role in this, meaning that the more hot flashes a woman has, the worse her memory performance. Although we do know that a primary contributor during menopause is estrogen and fluctuations in estrogen. That raises the question of whether or not hormone therapy might be beneficial. 3 large-scale studies now show that hormone therapy, when given to 50 to 60-year-old women, has no influence on memory, neither beneficial nor detrimental. Although we do know that giving certain forms of hormone therapy, conjugated equine estrogens and medroxyprogesterone acetate, doubles the risk of Alzheimer's disease when given later in life to older women. So does that mean that there's any hope for estrogen in cognitive functioning? The answer may be yes. First, we don't know what the effects of hormone therapy are in the very women who should be taking it, that is, women with vasomotor symptoms. That question is unanswered. And then secondly, the first neuroimaging study to measure Alzheimer's disease pathology in the brain recently came out, showing that transdermal estrogen is associated with lower levels of Alzheimer's disease in the brains of women who participated in a randomized trial. This work continues. Thank you.